Hello and welcome to Social Security Post, your trusted source for the truth about Social Security, SSI, SDI, Medicaid, and SNAP. Today we're covering a breaking development that has sparked serious debate across the country. In a newly signed agreement between the Centers for Medicare and Medicaid Services, CMS, and the Department of Homeland Security, federal immigration enforcement agents will now have access to key data from the Medicaid system. That includes names, addresses, birth dates, and other information necessary to help identify individuals who may be receiving taxpayer-funded benefits illegally. While this new policy is aimed at stopping the misuse of Medicaid by undocumented immigrants, it has generated a wave of questions, especially for those who are already struggling to afford health care. This issue affects all of us. Americans pay into these programs with the expectation that they are helping fellow citizens, not subsidizing people who aren't playing by the rules. If you care about how your tax dollars are spent, if you depend on Medicaid, or if you're worried about privacy, this is a video you need to watch through to the end. As always, please like, subscribe, and comment below if you have any questions about how this may affect you or your loved ones. Whether you're a senior on SSI, a working family using Medicaid for your children, or a disabled individual depending on critical support, you deserve answers and protections. Let's get into the full story. This week, CMS and the Department of Homeland Security signed a new agreement allowing ICE officials limited but direct access to the National Medicaid Enrollment Database. This access is being used to ensure that individuals who are illegally residing in the United States are not fraudulently obtaining healthcare benefits that are intended for legal U.S. residents and citizens. The information shared includes names, addresses, and social security numbers, data that helps ICE identify and locate individuals who may be unlawfully enrolled in the Medicaid system. The data will be used to confirm identities and flag inconsistencies that suggest benefit misuse. This move is part of a broader effort to strengthen program integrity and ensure that American resources are directed where they belong to the law-abiding Americans and legal residents who qualify for help. In recent years, growing concerns have emerged that the Medicaid system has become vulnerable to abuse, especially as millions of new applicants entered the system during and after the pandemic. Officials argue that this step is essential to make sure limited health care funding isn't diverted away from those who genuinely need it. While the majority of Medicaid users are indeed eligible, even a small percentage of misuse can cost billions. This agreement is intended to stop that drain and restore confidence that the system is being run fairly. Let's be clear, this isn't about going after innocent people. It's about making sure programs funded by hardworking American taxpayers are not being exploited. The Medicaid program exists to provide essential care to low-income U.S. citizens, lawful residents, seniors, and people with disabilities. That mission is noble, but it also requires trust and accountability. By allowing ICE to verify the legal status of Medicaid enrollees, this policy ensures that funds remain available for those the program was created to serve. With inflation rising and the national debt growing, it's more important than ever to protect every dollar. Supporters of the agreement believe this is a long overdue move to prevent fraud and prioritize American families. Too often, Americans who have paid into the system for decades are denied or delayed care due to overcrowding or budget limits. Meanwhile, stories have surfaced of non-citizens slipping through the cracks and receiving care they're not entitled to. That's not fair to veterans, single parents, or seniors who played by the rules. This policy is about restoring fairness, not punishing people. It's about giving legal residents peace of mind that their benefits are being safeguarded, not stretched thin by those outside the system. If you're a citizen, green card holder, or lawful resident, there's no reason to panic. This policy is not aimed at you. It's designed to identify individuals who deliberately enroll using false information or who remain in the country without legal status while receiving public benefits. For the vast majority of Americans enrolled in Medicaid, this change will not alter anything in your experience. Your coverage, your doctor's visits, and your medications will all continue without disruption. But for those who entered the system fraudulently, this change signals a crackdown. This may also protect you indirectly. When government systems are overloaded, legitimate users often suffer, whether through longer wait times, billing issues, or delayed coverage. By cleaning up the system and removing bad actors, states and providers can operate more efficiently and deliver better care. The new data sharing agreement means ICE can cross-check information against other databases to verify whether individuals are who they say they are. It's important to note that no action is taken automatically. Each case is reviewed carefully to prevent mistakes, and no one is removed from Medicaid simply for being flagged. Investigations follow, due process. Medicaid records contain some of the most accurate and up-to-date information about where people live and what kind of care they're receiving. For enforcement agencies like ICE, this is extremely helpful in pinpointing where misuse may be happening. For example, if someone claims Medicaid in 2 different states, or under 2 different names, or with mismatched information, ICE can now investigate that. Without access to this data, those kinds of cases would go unnoticed, costing the program millions. This isn't just about fraud prevention, it's about preserving the integrity of the healthcare system. When people know the system is being watched and enforced, it builds trust for everyone who uses it legally. It also discourages future fraud attempts. People who might try to game the system now know that there are real consequences, not just financial penalties, but potential removal from public programs. That helps protect care access for the elderly, disabled, and low-income citizens who are depending on Medicaid for basic health needs. This policy fits squarely within the Trump administration's broader goal of enforcing immigration laws while also safeguarding taxpayer-funded benefits for Americans. President Trump has long said that immigration policy should prioritize law-abiding citizens and legal residents, and that public programs should not become a magnet for illegal immigration. This data sharing agreement is a direct step in that direction. It's a message that public benefits are not open to those who are in the country unlawfully. While the policy may be controversial in some circles, it's being praised by many Americans who feel their voices haven't been heard in the immigration and welfare debates. For too long, people who played by the rules felt they were being left behind, especially when they saw others getting access to housing, food, or health care, despite not having legal status. This agreement says, "We see you, we respect your efforts, and we're prioritizing your needs." That reassurance is especially important in today's economic climate when many families are struggling to make ends meet. Some state Medicaid offices have expressed surprise at the speed of this agreement. In states like Illinois and California, officials said they were not given advance notice. While some leaders have raised concerns about patient privacy, the majority of Americans, especially taxpayers and Medicaid enrollees, want stronger controls. Most agree if someone is here illegally and using public benefits, that needs to be addressed. It's not about targeting people, it's about upholding fairness and ensuring that state programs serve their rightful communities. This agreement will also encourage states to improve their own eligibility checks. Many state systems rely on old data or lack the technology to verify information in real time. With federal support and oversight, states can now better align their data with other agencies, reducing fraud and helping residents access care faster. For honest Medicaid users, that's a win. States will also be better equipped to report misuse, take corrective action, and focus their limited budgets on those who need it most. If you're a U.S. citizen or lawful resident using Medicaid, this policy should actually give you peace of mind. It means your benefits are being protected and that the program will have more resources to serve you without disruption. That said, now is a good time to log into your state's Medicaid portal and make sure your personal details are up to date. Check your address, dependents, and social security number. Accurate records will help prevent any confusion in the system. Also, don't hesitate to speak with your local representative about the importance of protecting Medicaid from misuse. Support stronger oversight and policies that prioritize Americans first. If someone in your household is undocumented and using Medicaid, it's important to understand that they may now be subject to review. This is not about fear, it's about fairness. Everyone deserves health care, but it must be within the bounds of the law. The more honest people are in their applications, the stronger and more stable the Medicaid system will be for everyone who relies on it. This isn't about politics, it's about priorities. Americans who work hard, pay taxes, and follow the rules deserve to know that their healthcare system is protected from abuse. Medicaid is an essential part of life for millions of seniors, families, and disabled individuals. But without safeguards, the system becomes vulnerable. This new agreement between CMS and ICE is one way the government is trying to ensure that the help goes to the right people. It might not be perfect, but it's a step toward accountability, and that's something many Americans have been asking for. If you agree that programs like Medicaid should be safeguarded for law-abiding Americans, give this video a like, share it with others, and subscribe to Social Security Post. We'll keep you updated on the latest developments so you're never caught off guard. And as always, leave your questions in the comments below, whether they're about Medicaid, Social Security, SNAP, SSI, or SSDI, and I'll do my best to answer them all. Until next time, stay informed, stay responsible, and thank you for being part of a community that believes in fairness, security, and protecting what's rightfully yours.